Welcome to NCLEX Prep. Question 1. A nurse finds an adult patient unresponsive and not breathing. What is the first action the nurse should take? Option A. Start chest compressions immediately. Option B. Call for help and check responsiveness. Option C. Give 2 rescue breaths. Option D. Check pulse for 1 minute. Option B. Call for help and activate EMS code team. Question 2. Where should hands be placed when performing chest compressions on an adult? Option A. Lower half of the sternum. Option B. Upper sternum near clavicle. Option C. Over the left chest. Option D. At the xiphoid process. Option A. Lower half of the sternum. Question 3. What is the recommended depth of chest compressions for an adult? A. At least 1 inch, 2.5 centimeters. B. At least 2 inches, 5 centimeters. C. At least 3 inches, 7.5 centimeters. D. Half an inch, 1 centimeter. Option B. At least 2 inches, 5 centimeters. Question 4. How often should rescuers switch roles during 2 rescuer CPR to avoid fatigue? Option A. Every 1 minute. Option B. Every 2 minutes. Option C. Every 5 minutes. Option D. Only when 1 rescuer is exhausted. Option B. Every 2 minutes. Question 5. For infants, what is the correct compression to ventilation ratio when 2 rescuers are present? Option A. 30:2. Option B. 20:2. Option C. 15:2. Option C. 15:2. Question 6. What is the first step you should take when you find a person unresponsive? Option A. Start chest compressions immediately. Option B. Call for help and check responsiveness. Option C. Give 2 rescue breaths. Option D. Check pulse for 1 minute. Option B. Call for help and check responsiveness. Question 7. What is the correct compression rate per minute for high-quality CPR in adults? Option A. 60 to 80 compressions per minute. Option B. 100 to 120 compressions per minute. Option C. 140 to 160 compressions per minute. Option D. 80 to 100 compressions per minute. Option B. 100 to 120 compressions per minute. Question 8. When using an AED, what should you do immediately after it delivers a shock? Option A. Check for pulse for 60 seconds. Option B. Start chest compressions right away. Option C. Give 2 rescue breaths first. Option D. Turn off the AED. Question 9. Which pulse is checked in an infant to assess the need for CPR? A. Radial pulse. B. Carotid pulse. C. Femoral pulse. D. Brachial pulse. D. Brachial pulse. Question 10. If a lone rescuer is performing CPR on a child, what is the correct compression to ventilation ratio? Option A 15 to 2. Option B 20 to 2. Option C 30 to 2. Option D 5 to 1. Option C 30 to 2. Question 11. After 2 minutes of CPR, the patient shows a pulse but is not breathing adequately. What is the nurse's next action? Option A continue chest compressions. Option B stop compressions and begin rescue breathing. Option C apply the AED immediately. Option D place the patient in recovery position. Option B stop compressions and begin rescue breathing. Question 12. The nurse is providing compressions for an infant. What is the recommended compression technique for a single rescuer? Option A 2 thumb encircling hands. Option B, heel of one hand on the sternum. Option circa 2 fingers on the sternum just below the nipple line. Option D, both thumbs on the sternum with hands around the chest. Option circa 2 fingers on the sternum just below the nipple line.